Hello, everyone. This is Dr. David, and I'm here with Dr. Jerry Block. And some of you were on last Thursday when we had a fascinating presentation by Dr. Block, of course, on hormones, hormonal replacement specifically, and the importance of hormonal balance and what medical science can do to help you recover that hormonal balance. And I tell you, that's really, really needed. And it's Dr. Block has been a very dear friend, and I've come to respect him greatly for what he does, both in Tulsa and really through his seminars around the country. It's just an honor, really, that he would agree to work with us. So, Dr. Block, thank you so much. I appreciate your being on again. And we're going to be talking today about vitamin K.
Vitamin K.
Very unknown vitamin for the most part by most people, but it's beginning to gain some prominence, kind of like the way vitamin D has gained prominence over the years. So we're just going to go through all that, and without much further ado, I'm just going to hand this over to Dr. Block, and I will be helping him control the slides in the background. And then we'll just, if you have any questions, remember you can type into the chat box below our video, and you can type in your questions, and we will be able to we'll answer them as we go along. So, Dr. Block, over to you. Thank you, sir.
My pleasure. So, those folks who saw me last Thursday, it's nice to be in your living room, your study, your computer room, your office to again give this short presentation. I need to apologize initially is that I'm a novice in slides. So, Dr. David has agreed to work my PowerPoint presentation, which has never been given before on a video. So between what he's doing and I'm saying, hopefully you'll get a lot out of this. Vitamin K. Why do they call it vitamin K? Well, it was discovered way back in 1929. In fact, the Nobel Prize was given to Dr. Edward Doisy and Dr. Hendrik Dam. Dr. Doisy was University of St. Louis, and Dr. Dam, a Danish scientist, in 1943 received a Nobel Prize. They shared it. They both collaborated in finding out what vitamin K did, what it did not do, where to find it, etc. Of interest, it was first published in the German scientific journals, and it was called coagulation vite. Coagulation vite, and in German, coagulation starts with a K, and it was thought to be this was the thing that caused coagulation, so now they called it vitamin K. K for coagulation. If I were to rename the vitamin, I guess I would still call it vitamin K, but maybe K for chelation, and we'll soon talk about why this drug, this vitamin, this over-the-counter supplement will work like the IV chelation EDTA. Well, this vitamin gives protection against arterial calcification, Alzheimer's, bone loss, cancer, and even aging. There are many ways to make the diagnosis. One way to make the diagnosis, because this is so important in osteoporosis, as we'll soon find out, that there is a comprehensive nutritional panel done by SpectraCell. 33 different micronutrients are assessed, one of which is vitamin K. They harvest the white cells, they grow the white cells, and functionally they find out what is not in the white cells. Not just the vitamins, but other nutrients that we really just have an idea but don't know for sure how much or how little the individual has. Coenzyme Q10, glutathione, taurine, serine, and it gives an idea on the total antioxidant effect in the body called the Spectrox. Well, in the last year, I've done over 1,000 of these in various patients and found a fair number of folks did have vitamin K deficiency. So let's go on and talk about vitamin K. It really is a shield against a lot of things. It's a shield against arterial calcification, as I mentioned, bone loss, cancer, aging, and Alzheimer's disease. And talking more about it is that when it was first discovered, as I mentioned, it was thought to be a coagulation factor, and it had to do with clotting, and K is how the word clotting started. And about that time, in the late 30s, there was an epidemic of cows dying. And the University of Wisconsin did some research. They sent the veterinarians out in the field to find out what was happening. The cows were hemorrhaging to death. They were eating a sweet clover, and something in this sweet clover would cause the cows to hemorrhage. Since it was sponsored by the Wisconsin Alumni Research Fund, when they isolated this chemical in the 1930s, they called it warfarin, W-A-R-F, Wisconsin Alumni Research Fund. Well, if it was good enough to kill cows, maybe we can use this for something really useful. We don't want to kill our cows that way, so they used it as a rat poison. And for the next 20 years, it was used as a rat poison, and occasionally today we still find this in rat poison. Then some doctor got a bright idea. Gee, if it does cause the rats to hemorrhage to death, cows to hemorrhage to death, maybe we can control how much we give and keep the blood thin. So in the mid-1950s, it was used to treat folks that had clotting disorders, people that were hypercoagulable, folks that had strokes and heart attacks. And up to the last year, it was the most commonly used drug to treat folks that had clotting problems. Now it's been replaced by drugs such as Pradaxa, which is given orally, IV drugs such as heparin, and there's 7 others that are on the market and will be there shortly. So warfarin, Coumadin will be a thing of the past and only of historic interest. So the various things that we can use vitamin K for, as I mentioned, is calcification. As we age, our body becomes calcified. We literally turn to stone. Our soft tissues, such as our cornea, and when it happens in our cornea, this is starting of cataracts. Our glands, and some of our glands, such as our adrenal glands, may not work so well because it becomes calcified. Our blood vessels, and we'll talk about heart and the arteries later, and our heart valves, particularly the aortic valve. They found in autopsies that 75% over the age of 75 folks had significant calcifications throughout their body. And the problem is not caused by dietary calcium. It is caused by not enough vitamin K. There is an interplay, though, between another gland in our body called the parathyroid gland that secretes parathyroid hormone. And we know that calcium has effect on the parathyroid hormone, as does magnesium. And later on, when we talk about osteoporosis, we'll talk about how the PTH is affected by magnesium, how calcium does not do the right thing when one wants to calcify bones. The way vitamin K works is through carboxylation of various proteins. I'm going to show you a scheme very shortly, the last slide, and this scheme will say that if one has a protein, it needs to be activated by vitamin K to make it fully functional. The protein on the far right could be anything. Let's call this MGA. We'll talk more about that later. This is the G protein within the endothelium, within the lining of the blood vessels, that is necessary to be carboxylated. Otherwise, when it stays in the collagen, because of, that's my phone ringing, I apologize, I will turn it off, and I should have done this before I started, but I'm not used to such things. So it's off and we won't worry about it. So the MGA protein becomes carboxylated and keeps calcium out of the endothelium. On the other hand, if it's not carboxylated because there's not enough vitamin K, it attracts then calcium and the endothelium becomes calcified, hardening of the arteries. By the same token, vitamin K is regenerated from the hydroquinone up top to the epoxy on the bottom. It's regenerated naturally, but one can throw a blocker in there, and the blocker is warfarin. So if one puts warfarin in the equation, the vitamin K that was used to stop the calcium is now inactivated, and when it's inactivated, the body becomes calcified. Bones are leached from the mineral calcium, and the calcium is distributed to other places in the body that doesn't need it. The lens, the glands, the blood vessels, etc. Let's go back to the earlier slides. So that's carboxylation. In the arteries, as I mentioned, the GLA, the matrix GLA protein that we're going to call MGP, is undercarboxylated if there's not enough vitamin K. When it's not carboxylated, then calcium comes into the plaque and becomes almost irreversible. So, again, let me review this. The blood vessels are injured with a lot of causes. High blood pressure, high sugar, high uric acid, lipids not being well, fibrinogen, things that we're discovering such as plaque-2, Lp(a), MPO, a special enzyme that doesn't belong in our body, homocysteine, lifestyle such as smoking, affliction of other organs such as kidney disease, and because of this, the endothelium is damaged. And the arterial lining can repair itself. It produces collagen, and the collagen makes a nice fibrous repair on top of that injured endothelium. But within the collagen is the MGA, and that forms a cap. Under the MGA collagen, there are macrophages, and the macrophages engulf oxidize lipids, oxidize LDL cholesterol, and builds up a plaque. And that is the beginning of the end. So we feel that the plaque is somewhat reversible early on, but the longer the plaque exists, the more calcium that is laden down on the cap, the more irreversible it is. Atherosclerosis is just the plaque cooling soft, hardening, so to speak, and arteriosclerosis is the bone-like artery. The artery turns to bone. Arteriosclerosis, hardening of the arteries. Let's talk about something else. Our heart valves. As I mentioned, our heart valves become damaged, particularly the aortic valve. The aortic valve is the thinnest tissue of all the heart valves and is under the highest pressure. That plus all the other risk factors we talked about, lipids, smoking, high cholesterol, etc., damages the endothelium, which now is on both sides of the heart valve, the superior and inferior side. And because of this, the heart valve, the aortic valve, becomes calcified. 30% of people over the age of 70 have calcified aortic valves, and some people have it particularly bad, and the older person gets aortic calcification, aortic stenosis, and all that, what leads to death. Jack LaLanne, everybody knows Jack LaLanne, or used to know Jack LaLanne. He did everything right. His last book was written in 2003, Revitalize Your Health. And he talks about lots of good things, exercise, eating properly. But this was before the science was really developed about vitamin K. We knew vitamin K had something to do with osteoporosis then, but not that much to do with hardening of the arteries, and certainly not very much to do with aortic stenosis. His diet, if we listen to his book, read the precepts of his book, and practice it, our diet would be deficient in vitamin K. So he, at age 95, was diagnosed as having aortic stenosis, critical aortic stenosis. And he was talked into having a valve replaced. That was the beginning of his downhill spiral. He had complications of surgery. Subsequently, he's had infection after infection, and within 12 and a half months, he was dead. He died because of not enough vitamin K and too many birthdays. Well, if he had more vitamin K and did everything he preached, he would probably still be alive today. So I don't want you to forget about aortic stenosis, and not only can it be prevented by taking an adequate dose of vitamin K, and we'll talk what dose that is, but also don't let anybody talk you into having aortic valve replaced unless you really, really need it. Let's talk about some more issues. Bone health. Vitamin K, we've known for over 30 years, is important for the bone. The bone is a living tissue. It's in a constant state of renewal. The maintenance of bone requires that the old bone to be remodeled. Osteoclasts, which are cells that come into the bone, are in the bone. They dissolve areas of bone that are somewhat old and leaving holes in there, lacunae. The osteoclasts are turned off by vitamin K. If there's not enough vitamin K, the osteoclasts keep on doing their things and more holes are produced in the bone. It becomes porous, osteomalacia. But with vitamin K, the osteoclasts are turned off. In addition to that, there is a protein secreted by the osteoblasts. This is called osteocalcin. Osteocalcin needs vitamin D to be secreted, but to be activated, it needs vitamin K. And the role of osteocalcin with vitamin K is to call the calcium from the blood and other parts of the body to ossify the bone. So one needs vitamin D as well as vitamin K. So the two critical parts of vitamin K in keeping the bone healthy is, one, it turns off the osteoclast, and two, it activates the osteocalcin from the osteoblast to make the bone strong. But one needs more than just the vitamin K and vitamin D. There's other vitamins like vitamin C that we need to help the collagen. And if we're talking about the minerals, certainly people need calcium, but not very much. In fact, if a person has osteoporosis, it's not the calcium they need, but the magnesium. Calcium causes the parathyroid to secrete more PTH, which makes the osteoblasts work less and the osteoclasts work more. And in some studies, such as one by Diane Frankenfish, the Nurses' Health Study showed that those nurses, this was 72,000 nurses, 12 years, those nurses that consumed the most calcium had the most fractures. It is magnesium that prevents these, not calcium. If one has to pick another mineral, it would be strontium. Again, not calcium. So magnesium, strontium, if I pick a few more ions, it would be boron, and maybe zinc, and maybe iodine, but not calcium. Other than bones. There was another study done, a Framingham study, 7-year study, 888 elderly men, and they found that those men and women with dietary vitamin K intakes in the highest quartile, in the highest quarter, had 65% less risk of a hip fracture than those that were in the lowest quartile. So vitamin K is indeed the vitamin for the bone. And by the way, in places in Europe, they are prescribing vitamin K. In Japan, it's a prescriptive, and they use it along with terrible drugs like Fosamax that causes more problems than it helps. And with vitamin K, vitamin D, a few other things that I add to the bones, sodium monophosphate, that probably most doctors have not heard of. Some old-time dentists have heard it. Dr. Judd, who was a dentist, died about 12 years ago, did a lot of research because osteoporosis has to do with the loss of teeth, and I add a pinch of sodium monophosphate. You get it from veterinaries because old horses get osteoporosis. They feed it to old horses. It tastes a little bit like apple, but one little pinch, you can't taste it. Also, vitamin K has been shown to prevent cancer, lung cancer, pancreas, gut cancers, breast, bladder, liver, certain leukemias, and particularly prostate. In Germany, a study was done 8 years ago looking at the relationships between vitamin K and the development of prostate cancer. They did 11,319 men in 8.6 years. Compared with the lowest intake of vitamin K, those with the highest had a 64% reduction of prostate cancer. A drug was approved in 2008. Would you believe vitamin K was approved to treat prostate cancer? But this is vitamin K3, And that plus vitamin C, and the brand name of the drug is Apatone, Apatone, that got by the FDA as an orphan drug, is used to treat cancer of the prostate at a cost of 15,000 times more than you can buy over-the-counter vitamin K. Doesn't work any better because it's vitamin K3. And we'll talk about the vitamin Ks 1, 2, and 3. Actually, vitamin K is a group of isomers. We're going to call them vitamers, if I can make up that name. They have isomers, which are several very similar types of one ion or one metal, and a vitamer is several types of the same vitamin. So there's a vitamin K1, a vitamin K2, and vitamin K3, 4, and 5. Vitamin K1 is that which is directly derived from plants. Vitamin K2 is made by the intestinal bacteria. It uses various substrates, including vitamin K1, and makes it into vitamin K2. This is greatly more absorbed than vitamin K1 and has a relatively longer half-life. The plants that have the most vitamin K are the green leafy vegetables. Since it is a fat-soluble vitamin, if you're going to do your green leafy vegetables, you should put oil on it. Olive oil. The Mediterranean diet may work not because of the olive oil per se is healthy, but when they put the olive oil on the green plants, it makes the vitamin K within the plants 3 times more soluble, and they get more vitamin K. And maybe that's why there's less atherosclerosis, hardening of the arteries, heart attacks, strokes when people consume a Mediterranean diet. There are 2 isomers or vitamers that we probably ought to talk about, MK4 and MK7. Mephytin, and it has many other names, Mephytin K4 and Mephytin K7. These are vitamin K2 vitamers, and the 4 has 4 isoprene side chains. The 7 has 7 isoprene side chains on it. The MK4 has been shown time and time again to improve cardiovascular health and bone, but it's relatively short-acting, lasting only about 2 to 3 hours in the body, whereas the MK7 lasts much longer, 2 to 4 days. So if one is to take a vitamin K product, they need to take the right amount and the right form of vitamin K. What is the right form? I'm not sure. But I tell my folks to take a product that has at least 1,000 micrograms, that is 1 milligram of vitamin K1, the same amount of vitamin K2, and added to that mix is at least 100 micrograms or 0.1 milligram of MK7. There are many products on the market, such as a super vitamin K from Life Extension that has exactly that, and taking 1, 2, or 3 of these a day will prevent arteriosclerosis, cancer, aortic stenosis, Alzheimer's disease, because vitamin K is tied in with the plaques and the tau protein in the brain, and it does, so to speak, prevent aging. So that's my commentary about vitamin K. I did not follow the slides exactly. I know that Dr. David has tried to follow me with the slides, and about almost everything I said is on the slide. But I am writing a paper on what I said, and I think, Dr. David, you said it will be available.
Yes, if you click on the, hello folks, if you click on the top right of your screen, that's your top right, that's going that way, you can click on where it says thank you for attending this presentation. That will take you directly to the page, and that has the article that Dr. Block is talking about.
So take that to your doctor. Teach him what vitamin K is. And if you are spending $100 a treatment for chelation, some people get 2 or 3 a week to take the calcium out of your blood vessels and put it in the bone. You do the same thing for 30, 40 cents a day with vitamin K.
Wow.
So I'm open for questions, and last time people typed questions there, and I see there's a couple questions for me to answer.
Right, folks, you can type in your questions just below our video, and that chat box just below our video, so we'll fielding them here. And obviously the question is, and I think Dr. Block is already answering it in this slide. First of all, a good source of vitamin K, and then when is too much? Is there any danger in taking too much vitamin K?
There is no danger of taking too much vitamin K. Vitamin K's job is to carboxylate or activate protein that's in the body. I've heard doctors say that if you take too much K, your blood is going to clot. Not so. As I showed you in the diagram, you could only do so much with non-clotting, and it completely saturates the precursors, the clotting factors that are made in the liver, and you can't get too much of it. Once they're 100%, they're 100%. You can't overdose on vitamin K. Now, this is vitamin K1, vitamin K2, vitamin K3, 4, and 5, of which is only vitamin K3 on the market now, but other companies are trying to bring out vitamin K4 and 5 and sell it for a big, big profit. There's toxicity in that because there's no turning it off.
All right, another question. Alzheimer's disease. Obviously, people are very interested in brain health, and I believe you were speaking with one of our guests before the presentation about eye health as well. And I know you touched on calcification, but how does this help?
So, Carol, I know you're listening to me again. We had a lovely conversation when you called right before to see if you can hurry up and pay your money so you can listen to vitamin K. You have a different problem, and I don't think this is the drug to bring back your sight, but I do know it can hurt you. Those folks out there that have immature cataracts, this is a deposition of calcium in the cornea, in the lens. The vitamin K will prevent that. Vitamin K itself is a wonderful, wonderful antioxidant, and antioxidants in general will tend to prevent cataracts. It will tend to prevent the complications of diabetes. In diabetes, there's a marked increase of age, advanced glycemic end products, and these literally not only rust the pipes, but rust our lens in the eye to cause cataracts. And vitamin K will go a long way in preventing that.
All right. So most of vitamin K's usefulness derives from its ability to control and reverse calcification. Is that correct?
Calcification in the blood vessels, calcification in the aortic valve, calcification to help in the bone, puts it in the right places. But in addition to this, it works against the natural forces that deform DNA and makes a DNA molecule more susceptible to become cancerous. If it's super antioxidant, it puts methyl groups on the DNA, stabilizing the DNA, so there's less likely for it to cause cancer or other cells to become runaway because of abnormal nucleus with the DNA, the chromosomes.
So it is indeed an antioxidant.
It is an antioxidant.
At what level? I mean, we have the level of the glutathione, the superoxide dismutase, and the others.
They all work a little bit differently, and they all work in concert with each other. So one needs not just the woodwinds, not just the brass, but one needs the whole orchestra to give a wonderful symphony. And one needs the vitamin K, not alone, but the vitamin K with the glutathione. And I understand we can give glutathione, and there are mechanisms to get it in the body, or one can use NAC, which is precursor to glutathione, and we can add that to the orchestra.
Tell us a little bit more, Doc, about, and there's a question about calcification, which you've already answered, but a little bit more about Alzheimer's disease and other dementias. Obviously, the root cause there is inflammation, right?
We feel that cancer, heart attacks, strokes, and dementia are caused by inflammation. The NK, the kappa protein, which is activated and is the seat of inflammation, is inactivated by vitamin K. So it does quell down inflammation. Folks, and I measure the HSCRP, the heart-sensitive CRP, C-reactive protein, which is high when people have a large burden of atherosclerosis, which is really an inflammatory burden, and I put these people in vitamin K, and the CRP does come down as a reflection of decreased inflammation.
Interesting. Okay. So, Doc, okay, that's another question. Okay, Anne wants to know,
Do we only get vitamin K through eating greens? Does this include salad greens? And what form of vitamin K does this give us? Vitamin K1 or K2 or K3?
We do get vitamin K from other sources. Soy bean oil, which is not very healthy. Soybeans there's no joy in soy, has a lot of vitamin K. It's leached out of the soybean. The soy and other plants have vitamin K1. The greener the plant, the more the vitamin K. So any kind of green plants, but in general, the darker the plant, the better the vitamin K. The brassica, such as chard, broccoli, spinach, has lots of vitamin K.
I see.
And if one uses oil, it solubilizes that vitamin K1. It's ingested in the gut. If the gut has healthy flora, the gut will turn that into vitamin K2 and will make the MK4 and MK7.
You bring up a good point, a very interesting point. Vitamin K is deficient in patients who have had a significant aspect of their intestines. Colons removed?
Oh my gosh, sure is. Okay. We know, and you've been in hospital medicine, when somebody is really bad sick, if they had surgery, they're not taken orally, they've had antibiotics, the flora is not working, or they don't have the gut because of removal of some of the intestines, they can't make vitamin K. And we notice that because they start bleeding. They don't heal after surgery. They start hemorrhaging. And one does the blood test, the proton. They find it's sky high. And they try to give lots of vitamin K to overcome it. And sometimes it does, and frequently it doesn't, because it takes more than vitamin K. One other aspect about vitamin K and bleeding, there's now a trend to use vitamin K together when a person takes warfarin. We know when an individual does warfarin, docs tell patients not to take vitamin K, of course. They tell them not to eat green leafy vegetables because it contains vitamin K. Well, taking very amount of vitamin K will affect the clotting time, what we call the pro-time. It used to be in seconds, and now we talk about the INR, the international ratio. And if you use vitamin K one day and not the other, it changes. Well, some doctors are now routinely giving vitamin K, and the studies did vitamin K in the form of MK7 on a daily basis. They did 68 micrograms a day of vitamin K in folks that were taking Coumadin every day. So the individual would not have the variation of I and R. So in the study they did, the average INR was 2.4, and after vitamin K, 68 micrograms, it dropped down to 1.8. They increased the Coumadin just a little bit more by 12%, and they maintained an INR throughout the entire year without having to change up and down. And it's the up and down changing of the Coumadin that causes not only hemorrhage if they get too much, it also causes clot if they get too little. That's why Coumadin may not be such a good drug, and drugs like Pradaxa are being used, but in the future, more avant-garde doctors will be using vitamin K along with Coumadin. If your doctor is skeptical, please let them look in the literature, and I believe there is a article, only say reference to an article in my notes that are on the slides.
And just remember, folks, just by clicking on the top right, that button that says thank you for joining this presentation, you will have access to those to that article that Dr. Block is talking about. Okay, Doc, let's talk a little bit more about osteoporosis, because a significant number of women that listen to our presentation.
Not just women, men. Men have 70% of the incidence of, we thought it was a woman's disease. Well, men get it, but they get it later, but they certainly do get it.
So hip fractures, are you saying this is has a more male preponderance? Or?
No, it doesn't have more of a male predominance. Certainly osteoporosis is more in females, and because of lack of hormones, usually a male keeps their hormones later, and almost every woman, by the time they reach the age of 50, don't have their hormones, as we talked about last Thursday. Right. That has a lot to do with it. Also, the men do more physical work than women, and that has a lot to do with it as well. Also, men don't have as much adiposity as women, and that has a lot to do with hip fractures as well. So your question is?
The question is, supposing supposing any person has a hip fracture, and what we know is the statistics is that once someone has a hip fracture, especially a woman, and she's in the hospital, over 20% do not leave the hospital.
20% don't. And those folks that do, they have almost 100% higher incidence of dying within the next year. And most of them die of cardiovascular disease because, as you know, that osteoporosis is associated with atherosclerosis, arteriosclerosis, because of lack of vitamin K. And there is the duality of that.
Okay, so if someone has that, someone has a hip fracture, let's say someone's mother has a hip fracture, what would you advise the daughter or the son to do for the mother?
Well, in this day and age, surgery is indicated. Repair that hip with a prosthesis is indicated. Out of the hospital as soon as they can. Rehabilitation, starting to walk within the next 2 days, not keeping him in bed because of blood clots and so on. And the nutrients they need is not the lousy Fosamax or the Beniva or the Actonel or the IV Zomad or the new drug Prolia, Prolia, which is the most expensive of all of them and doesn't work worth a darn. But as I mentioned, the vitamins D, and when we talk about vitamin D, I'm talking about 20,000 units a day. 20,000 units a day. Very, very inexpensive. I tell my folks to go to Sam's, and for $10 you can get 400. Each little pill capsule contains 5,000, and 4 of these a day, 20,000. I usually check vitamin D levels. They say normal vitamin D is somewhere between 30 and 100. And toxicity is greater than 100. In my laboratory, normal is between 80 and 100, and toxicity is greater than 300. So I tell them, without even checking anything, to do vitamin D 20,000. Periodically, I would do a calcium level just to make sure, but I've never seen anybody with a high vitamin D intake and high calcium unless they had other problems, parathyroid or cancer of the breast or so on. In addition to the vitamin D, of course, vitamin K. We talked about it. One should have the combination, the triad of 1,000 mics of K1, 1,000 mics of K2, and 100 mics of MK7. The other vitamin is high doses of vitamin C, 2,000 to 4,000 milligrams a day, and the minerals, magnesium, strontium, maybe zinc, iodine, and very little calcium.
What do you mean very little calcium? Isn't that the traditional, conventional thing is you need more calcium? That's why you had osteoporosis in the first place.
Well, the problem is that they give calcium. It works on the parathyroid hormone, stimulates it, that causes more osteoporosis. I quoted this study by Diane Frankish at Harvard School of Public Health. Those nurses, 72,000 nurses that had the most calcium intake in the previous 12 years had the most fractures. It's not calcium, folks. It is magnesium that they need. It's strontium that they need. It's vitamin K that they need. It's vitamin D that they need, not calcium.
Well, that is so. That's so counter to everything that we've learned about. Especially in this country, on the news and on the commercials, it's like you're lacking vitamins and calcium.
There's 30 articles written in the last 2 years that it's not calcium. It's magnesium that they need.
Wow.
I have folks, and I've been doing the strontium, the magnesium for almost 15 years. Fosamax has been available for 19 years, 2 years it's been generic. And it takes me 4 to 8 years with a Fosamax to get their bones even one standard deviation above. By that time, they develop rotten jaw, or now they're developing other fractures. You heard about pathologic fractures, particularly the shaft of the femur, and folks are taking the biphosphonates. On the other hand, within a year of the cocktail that I mentioned, vitamin K, etc., I've seen people go from -3 -3 standard deviations to 0 within a year. It never happens with those folks taking calcium, Fosamax, Bonevia, Prolia, etc.
So not only are they spending a lot more money, they are not doing nearly as much good.
Oh my gosh, yeah.
Hmm.
They're not.
Hmm.
They get rotten jaw. Now that's rare. The higher doses do it, and folks that take the average, it happens 1 in 7,000, and there usually is an underlying dental problem, but it's relatively rare. But it does happen. But the bad thing is that they maintain their thin bones. They're at risk for having fractures, not just fractures of the hip, but compression fractures of the spine. They get shorter. They get entrapment disease because of the radicals leaving the spine. The nerves get impinged.
So, okay, you've just talked about what happens if someone has a fracture, and you've reeled off a couple of doses of vitamin K, vitamin D, and all that. Prophylaxis, prevention of the fracture in the first place.
Vitamin K.
Okay.
Vitamin D.
Doses.
Vitamin K, again, there's no toxicity. 2,100, again, 1,000 of K1, 1,000 of K2, and 100 of MK7. Doses of vitamin D between 10 and 20,000 a day. C between 1,000 and 6,000 a day. Magnesium. Now, I like magnesium chelate. The one that I like the best is magnesium citrate. There's a product called Calm. It comes in a powder, 3 teaspoons a day. Magnesium oxide, which is the most prescribed, recommended magnesium, is poorly absorbed, and if one was to do it, it comes in 250, 400, 500 milligram tablets. You need 15 a day of that, but 3 teaspoons of Calm. In addition to that, strontium 750 milligrams 3 times a day. How much zinc? Zinc 25 milligrams a day. How much iodine? If one was to use iodine, 5 drops of Lugol solution or 2 iodoral tablets. Boron 1 to 3 milligrams a day.
Great, thanks, Doc. So, and this is for what age should we start being concerned about that?
It depends on your family history, other lifestyle, smoking, lack of exercise, and if one is in harm's way, this should be started in their 20s. The best way to do it, this is what we do, is that we do a micronutrient from SpectraCell, see what the vitamin K levels are, see what the intracellular magnesium is. By the way, if you get a serum magnesium, it's only a minimal reflection as what is intracellular. Magnesium is an intracellular ion. See what the intracellular zinc is, and then formulate a program based on scientific evidence rather than what one suspects.
Fantastic, fantastic.
So the bottom line, you have my slide there, the effects of higher ingestion of vitamin K. And this is a 26% reduction in all-cause mortality, a 57% reduction in coronary artery disease, and a 52% reduction in severe aortic calcification.
That's huge. That's huge.
I used to be a cardiologist before I was a real doctor, and I still do echocardiograms, and I do find aortic stenosis very, very common. I find before that, in people over the age of 40, many of them have calcification of the aortic root. They're on their way. And this is reversed. I put them on vitamin K. A year later, I relook at their aortic root, and the calcium disappears.
This is amazing. That is just amazing. I wish more people knew about this. Okay, Judy has a question. Oh, okay, let me go back up. Pat has a question, but Judy has a question. I have just finished breast cancer treatment. Can I take 20,000 units of vitamin D?
You better, because vitamin D not only prevents breast cancer, but it stops the growth of breast cancer. Please do. The study after study for your breast cancer, 4 or 5 things to do. A lot of what we just talked about. Vitamin D, vitamin K, and the doses we talked about. Iodine for sure for breast cancer. And then there are the sulforanes. The sulforanes are in the Brassica family. such as broccoli. And if I were to use broccoli, I would do broccoli sprouts. It has more sulforanes than any other live food on the market. But if you don't want to do these, one can get DIM, diindolmethyl. One can use 1,3-C, I3-carbinol. These are parts of the Ricilica family, the sulforanes, the sulfogluterones that tend to prevent breast cancer and inhibit its growth. I also recommend vitamin E, not vitamin E, estriol, estrogen. Why would anybody give somebody with cancer breast estrogen? It's not the E2, certainly not the E0 estrone, not the estradiol, not the estrone, but E3. Estriol is used routinely in Germany to prevent and treat breast cancer. As much estriol that you can take, I would recommend. And there's no testosterone receptors on your breast cancer, and I would add testosterone. Progesterone, natural progesterone, even though a patient does have progesterone receptors, I give progesterone. The cell has to have some receptors. That doesn't mean if you give progesterone, they get more cancer. Now, this is bioidentical. The culprit that causes breast cancer, if there's any hormone, it is the medroprogesterone, what they used to call Provera, available today at Prempro and many other products.
Okay, and folks, if you missed the presentation on hormonal therapy, please get it. It's on our site, so you can go back and look at it. All right, Pat has a question. Please repeat how we can find MK7 as a supplement. Did I miss this?
One can probably go online and get MK7, but usually it's part of a package of other vitamins. Life Extension, 1-800-LIFE-EXTENSION or lifeextension.com. You'll find their super vitamin K.
Great.
Are you going to show my book?
Yes, I'm going to show Dr. Block's book.
Oh, we showed him this last time.
We did. We got to keep showing it.
Yeah, but I don't have any copies left. They're all sold out.
Oh, they're sold out?
I think I have 20 or 30. There's going to be another printing, and on page 200 and something, I talk about vitamin K.
Page 200 and...
Well, 286. I talk about vitamin K.
The book, folks, is called, let me just get out of the way since I can't fit in. The book is called, and by the way, Dr. Block, you look great for a 73-year-old.
Let me show you my other side because I don't want to look like I'm an exercise guy.
Well, you are an exercise guy. He works out like 4, 5, sometimes 6 times a week, Doc, right?
4 or 5 times a week.
My goodness,
I work
that's
50,
intense.
60, 70 hours a week. Gee, give me a break. I'm 73. I got to watch television. I have a wife.
You have to keep up with your wife and your 8 kids as well. I mean,
17 grandkids.
17 grandchildren. Oh, my goodness.
22 employees. I don't know.
Oh, by the way, Dr. Block's website is docblock, docblock.com, and he has a wealth of articles on his website that you can go into and peruse.
Well, I'm rebuilding it again. Yes, there's 300 articles that I've written over the years. Some have been published in medical journals, a lot in magazines, and I have a weekly Sunday article for 5 or 6 years that I've updated those. Yeah.
And you also have a radio talk show program.
I do have a radio talk show.
It's almost like you didn't have enough work to do, so you had a radio talk show.
And this is Sunday. This is Sunday 9 to 10 right before I go to church. Yes, I do.
That's right. And I've joined him on a couple of those radio talk shows as well, and it's been a great honor to do so. Excellent, excellent. So any more questions before we end this? Okay, spell out his website. Yes, it's docblock, docblock.com. docblock.com. And of course, Dr. Block, I mean, I am not going to let him go.
Why?
As much as we possibly can, we're going to get you back on to talk about several
topics. You told me
topics.
I only had to do 2.
No.
We shared. You were my radio program twice.
I lied. We're going to have to do much more than that.
I told everybody all I know. I don't know anything else.
All right.
Actually, I am a doctor, and I use the word doctor in the Latin sense. It comes from docere, to teach, and I love to teach you folks so you can teach your doctors how they should practice medicine. The title of my book is the doctor within. So you've heard long ago, 2 doctors, 3 opinion, but the opinion that really counts is your opinion. It's not the doctor who prescribed Fosamax that's going to get in problems with his rotten jaw. It's you. So you need to be very careful. Choose wisely what you can hear your doctor, but don't listen to him. They don't like that. I love patients who are responsible for their own health.
I think that's the smart way to go. That's what we all have to do, because patients, like you said, it's the patient who lives with their body 24/7, not the doctor. The doctor has several people to take care of.
Nobody loves the patient like they love themselves.
That's right.
Nobody knows the patient who lives with themselves, as you said, 24/7. And it's the patient that's going to suffer the consequence,
That's right.
not the doctor. So it's incumbent upon the patient to know all they can about themselves. If they have an issue, a challenge, they should learn about that, learn about it from webinars like this, from books, from magazines, online, get proper online sites, because there's a lot of commercial sites that want to sell a product, and then make a decision.
Mm-hmm.
Listen to the doctor. He's just one voice. So
Right.
there's many other voices out there. And don't be afraid to get a second or third opinion. And if you're talking about a surgical opinion, go to somebody who doesn't do surgery. If you're thinking, or the neurosurgeon says you need to have a back surgery, don't go to another neurosurgeon or orthopedic surgeon, because that's how they make their living, by doing back surgeries. Go to a neurologist, go to a chiropractor, and ask them if they really need to have the surgery.
Oh my, Doc, you could get in trouble for saying all this.
Come on.
I'm sure you.
Oh, I already did get in trouble.
You did, didn't you?
I testified against the AMA, the American Chiropractic Association, way back in 1979.
Oh,
And
wow.
at that time, I was teaching in the University of Missouri at Columbia and practicing in Sedalia, Missouri, and the state board wanted to take my license away
Why?
because I was for the, those days, chiropractors were considered a cult, and anybody who was in league with them, in bed with them, was aiding and abetting a doctor practicing medicine without a license. That's what they said to me. But I stood up, and I still have my Missouri license.
Well, Doc, it's because of people like you that we are able to do what we're doing, because it's we need people like you to stand up.
They didn't throw me in jail. They threatened.
Yeah. That's amazing. And chiropractors do a good job. Okay, Pat, last comment here. Pat says, thank you for being specific with the dosages.
And you folks out there, I really will be back again. Dr. David will pick a topic of whatever his little heart desires, or you folks request. And if you can stand me a third time or sit me a third time, I'm glad to be here.
Okay, great. Thank you so much, Doc. And folks, this is just a small part. I'm just coming to the screen again. This is just a small part of what we do. The longer videos are there, but we're also doing a lot of short videos where we address specific topics, 2 to 5 minutes. Dr. Block has talked about exercise, he's talked about hormones, and we're going to get him, he's going to do several other series. And this, and yes, you are. Several other series, and these will be available for members, not for the general public. I mean, we are actually amassing a huge library of short
David,
videos.
do you do this often? Don't you have your doctor in the other part of the country? Do you come to their office and make sure they don't leave until I do this program? I didn't get to eat my supper. I haven't seen my family. Do you sit here next to the doctor? Do they put their arm around you and say, we're buddies?
You see, that's the disadvantage of being in Tulsa, Doc, because that way I can bug you anytime I
I should have
wish to.
stayed in Kansas.
You should
I
stay in
moved here
Kansas.
4 years ago. I had a nice little practice little town. I come here and look what you did to me.
All your fault. You can move back if you need to, but I'll follow you, I guarantee you. So these videos are going to be available on the site. And again, if you want to be a member, this is extremely cheap price. At one point, it was $20 for the entire year, Doc, and they could go in and watch over 300, 400 videos. So, and then
Wow.
that's just the minimum. We're going to keep increasing and improving upon this content. So we're making it as cheap as possible, so you don't have any excuse. You've got to go and get educated, get informed, so you can take control of your own health. I want to thank you guys for joining us, and please join us again on Thursday. Jackie Harvey's who's going to be talking about hormones, specifically breast cancer. This is the Breast Cancer Month, Breast Cancer Awareness Month, I believe. Yes. So she's going to be talking about hormonal balance and breast cancer prevention. So you want to be on that
for Thursday. These webinars are all free. You don't have to be a member.
Can I listen and ask her questions?
Absolutely, Doc.
Is she a good friend of yours?
She's a good friend of mine. She's up in Canada, but she'll be streaming in from Canada. That's the good thing about internet. So she's she's a student of John Lee, and
oh, sure.
Yeah.
She loves progesterone.
That's her primary focus, progesterone balance and all that. Yeah.
Poor Johnny's dead.
Yeah, he's dead. Yeah.
Nice guy.
Yeah, I think he was too. Sounds like. All right, so we're going to wrap it up here, folks. Thank you for joining us. God bless. Have a good evening.
He died